You could leave the audience with one piece of advice for successfully scaling value-based care in today's environment. What would it be? Or you could just use this 1 minute for whatever you want to talk about. Evelyn?
It's hard. There's no quick fix, easy answer. Healthcare is delivered locally, so what works in one market or with one partner will not necessarily translate to the same results with another. And I think where we are most successful, where we are most energized, I would describe our relationships with our partners, both the person who is sort of aggregating patients for us and for the care community who is supporting them locally. We are uncomfortably close. Meaning we are literally in each other's stuff all day, every day, and not just on core clinical care. We're talking about what services can you turn off so they're not fatigued by you calling them, and that when we actually call them because we mutually agree their kidney disease is the most important thing, they will take our phone call. We can talk about the data, like accelerating the data around the core clinical operations. Can we do gold carding and fun stuff with prior auths? Like everything is on the table and we are talking all the time. And so I think that's what makes it all possible, is that we're coming to the table in the spirit of collaboration and willing to try and see what can work.
Thank you so much. Cappy?
Start somewhere, right? Pick a condition or a place that makes the biggest impact right away to get you some early wins, right? We typically will start with suicide ideation programs. 50,000 people die a year, hundreds of thousands of people, attempt suicide. But it's possible to be able to get to those people early and give them a safety net. So start there. Start with MSK and depression, something that moves the needle both for the provider that's doing the work and you're asking them to do more, so they should be paid more, and at the same time make an ROI that impacts the payer across a big part of their population. After that, start eating around the cookie, right, and moving in a little bit, is what I'd say.
Ron, bring us home.
I would say you have to think about your business, both your financial relationships and your operating relationships, as though they're going to be long-term relationships. Because as everyone said, you're going to be in each other's shorts. You're going to be dealing, well, she might not have said it that way. You're going to be dealing with things that, if you're very siloed, you would say, you have no reason to know that or understand that or be involved in that. And when you have partnerships that have that kind of a dynamic, you'll never get to the things that can be changed with deep integration. But to have that deep integration, you can't change that year after year after year. You've got to have long-term relationships, which mean you then need to think about how am I not taking the last nickel off the table? How am I leaving something there for all of my partners?
Yeah.
That's the only way I think this is going to work.